We present a novel technique to address graft tunnel mismatch in bone patellar tendon bone anterior cruciate ligament reconstruction. There are no relevant financial disclosures. Standard harvesting of bone patellar tendon bone autograft is then first performed. As you can see here, preparation of the graft is then next carried out. It is our preference that one suture be passed through a drill hole in the tibial bone block and 3 sutures to be passed through the separate holes in the patellar bone block. Any excess tissue is then removed for ease of passage of the graft. The tendinous portion of the graft is then measured here. If the length is greater or equal to 50 millimeters, a decision is made to place a locking suture for backup, as in this case. The graft is then marked at the insertion site of the patellar bone block, which in this case measures 50 millimeters, and the same is done at the tendinous portion next to the tibial bone block. Given that the length of this graft was 50 millimeters, a decision was made to place a locking suture for backup. As you can see here, this is done using a 1.3 millimeter suture tape fiber loop by Arthroscopy and is done 2 centimeters proximal to the patellar bone block. This is done in a standard running grasping stitch technique, and 4 to 5 passes are made with the suture. Standard ACL reconstruction is then carried out, first securing the tibial bone block in the femur. Examination of patellar bone block and the amount of protruding bone block are then next examined. If this amount is less than 5 millimeters, standard fixation is then used with an interference screw with no backup fixation. However, if greater than 5 millimeters of bone is protruding, an interference screw is then first placed in the tibia and a sagittal saw is then used to trim the excess bone protruding outside of the tibia. Any remaining sutures from the bone block, in addition to the 2 ends of the suture tape, are then placed in a 4.75 millimeter swivel lock as backup fixation. The knee wounds are then cleansed and closed in the standard fashion.